The thalidomide tragedy is a devastating chapter in the history of medicine that unfolded in the late 1950s and early 1960s. Thalidomide was a drug marketed as a sedative and antiemetic, anti-nausea medication, and it gained widespread use, particularly among pregnant women, to alleviate morning sickness. The drug was first introduced in the late 1950s and was initially marketed by the German pharmaceutical company Chemie Grünenthal under the brand name Contagan. Thalidomide was touted as a safe and effective remedy for a range of ailments, and it was made available over the counter in many countries. Its popularity grew, and it was heavily promoted as a non-toxic alternative to other medications. However, tragedy struck when reports began to emerge of an alarming increase in the number of babies born with severe birth defects, especially limb abnormalities such as missing or shortened limbs. It became clear that there was a direct correlation between thalidomide usage during pregnancy and the occurrence of these congenital malformations. The extent of the thalidomide tragedy became apparent as thousands of children were born with profound disabilities in more than 40 countries. The drug had been prescribed to pregnant women during a critical period of fetal development, leading to severe developmental issues in unborn children. Investigations revealed that thalidomide had never undergone rigorous testing for its safety during pregnancy. The drug's teratogenic effects, meaning its ability to cause birth defects, were not recognized during its development and initial release. Thalidomide had been marketed without proper scientific evaluation of its potential risks, and the devastating consequences became evident only after it had been widely distributed. The thalidomide tragedy prompted a re-evaluation of drug approval and testing processes worldwide. Regulatory agencies, such as the US Food and Drug Administration, FDA, implemented more stringent protocols for drug testing, emphasizing the need for thorough preclinical and clinical trials before a medication could be approved for public use. In the aftermath of the thalidomide disaster, legal actions were taken against the manufacturers and compensation was provided to affected families. Thalidomide itself was withdrawn from the market in the early 1960s. Despite its tragic legacy, thalidomide has found a niche use in recent years, particularly in the treatment of certain conditions like leprosy and multiple myeloma, but under strict controls to prevent its use during pregnancy. The thalidomide tragedy remains a poignant reminder of the importance of rigorous drug testing and the need for vigilance in ensuring the safety of medications, particularly for vulnerable populations such as pregnant women.